This is what we call a wafer grid. It's just a plain grid maybe that is used with portables. There are grids that what we call grid caps. So this is a grid that has a frame around it, so you can just put it on your image receptor,
That's
and it
portable.
holds it on there.
Is it portable? I mean,
Yeah, for your
even
portable X-rays. Yeah, this is when you need a grid when you're not using the Bucky tray. So if you're doing something maybe across the table that you would normally use a grid for, you have these grid caps, and they come in the same sizes as the cassettes. And so the cap is nice. Not, I particularly like this one because it allows the corners open so you can separate them pretty easy. Here's another design, a grid cap. It has the corners on there, and it's just a little bit harder to pry it out from there, but either one will work. So it's just a frame. It's still a wafer grid with just a nice frame built around it. Otherwise, to get these wafer grids to use, you can see what we use to hold it on, is tape, you know. So, and you have to be careful when you're using these grid caps, or any wafer grid. There is a tube side. This one makes it pretty easy. You know which side's the tube side because of the frame. But when you put this in here, you want to make sure the tube side of the image receptor is facing the grid, like that. You don't want to put it in backwards. So pay attention when you're using grid caps or grids. Same thing for the wafer grid. And I've done it, I've used the wrong side. There is a tube side and a non-tube side. So the tube side has to face the X-ray tube, and then this would face the back side of the grid. So just make sure when you're using them together that you have them set up properly. Okay? Let's talk about grid efficiency. There are several things that make the grid. We have different grids may be used at your hospital, and the wafer grids that we have here may be a little bit different than the ones that you have in your table underneath your tabletop inside your room. So there are some physical factors which I can relate to better than the other factors, but the physical factors are the grid ratio and the grid frequency. So the grid ratio, and you do need to know how to figure this out, is the height of the lead strips to the distance between the lead strips. Okay, so the height to the distance. And typically as the ratio of the grid is higher, and what are some ratios? They're 4 to 1, 5 to 1, 6 to 1, 10, 12, 16 to 1 is the highest that I know. As you increase the ratio, what would you expect to happen to the efficiency of the grid? Does it get better? Does it get worse?
It gets better.
It gets better. It gets better at what?
Fit around.
Cleaning up the scatter, attenuation of the scatter, absolutely. Grid frequency refers to the number of lead strips there are per inch or centimeter. We tend to use centimeters more often, but so many lead strips per centimeter, and it's going to be given. Your grids are usually labeled, and it'll tell you what the frequency is. You don't have any control over that so much. Oh, and I wanted to pass this around. I'm going to pass around this grid. I've tried to peel off the outside frame. This is just an aluminum frame to hold it all together. And so I've peeled off some corners. So feel free to look just how thin the lead strips are and how close they are together in reality, as opposed to these pictures where it looks like they're this far apart. Just don't cut yourself. I don't think we can, but just in case, be careful with it. I don't care about the grid. I care about your fingers. Yeah. If you can peel off any more of that, feel free. Tear that thing up. I don't care. I've got plenty of them. So grid frequency is the number of lead strips. When you're doing using the grid portably, then it's a stationary grid, and so you may or may not see grid strips on your image. If you do, that is okay. You do not repeat because of that. Radiologists are used to seeing that. The higher the frequency is, the more grid strips that you have per centimeter, the less likely you're going to see the grid lines on a radiograph. So when we use the table and the grid underneath the tabletop in our rooms, those grids move, and so it blurs out those grid lines. But when you're going across the table, when you're doing something portable, you don't have that moving mechanism, and so therefore you'll probably see grid lines, and that's okay. That's not a problem.
So what direction they moving or all around?
There are different types, but the one that we have now is what we call an oscillating grid. And, you know, when I was your age, I'm like, oh, oscillate, it moves in all directions. So I'm thinking it goes like this. No, it vibrates. It goes like that. Yeah, real tight. You know, it just oscillates. And so it's not a big motion. You only need a little bit of movement to blur it. So it oscillates very fast. Before, and we're going to talk about the different types, but before it would, you know, move across, you know, move from side to side. And anyway, I'll show you now. But you don't have that moving mechanism. So again, you may see those lead strips. And as we increase the number of lead strips, again, what happens is that the interspace material that's in between is less, and therefore the grid ratio will go up because of that distance there is decreased. You gotta be able to get. How do you get more grid strips in there? Is by decreasing the interspace material. And what can the interspace material be? It can be nothing. It can be fiber. It can be aluminum. And what the interspace material does, it keeps the grid lines straight. And so anytime you drop these, the grid strips in there can be, I mean, you can see as you play with that grid coming around, it's lead, it's very malleable. And so when you drop these things, those grid lines can come out of place, and then they'll really show up on your images. So you don't want to drop these. So here I am I think I was a student. I'm just going to say I was in case I wasn't. And so I went to pull the grid cap, and these are heavy. I'll pass this around with the frame on it. These are pretty heavy. Have you picked these up? Have you used these yet? So anyway, we had a cabinet like the one in the back, and I was in a hurry, so I grabbed it, and it flung right out of my hands. It bounced 3 times. I couldn't do that again if I wanted to, but it went boom, and then turned. It was beautiful. Boom. Boom, right in front of my supervisor. It landed right in front of her, and I'm chasing her, and she's standing right there, and I'm like, oh. She's like, well, we'll just kind of get a new one of those, I guess. And I'm like, huh? I didn't mean to. I always say I didn't mean to, and if I did, I couldn't help it. But you want to take care of those because they are expensive and they do have to be replaced if there's going to be artifacts in there. That will produce an artifact, and the radiologist can't read that. I mean, they could, but they're not going to be happy with that. So here are your lead strips with the interspace material in them, and this is how you determine the grid ratio. And so, let's look at this one down here, not this one so much up there. We're kind of opposite. But the higher your grid ratio, the better it is at cleaning up scatter. Here, for the same scattered photon, you can see the higher that the grid strips are, that it will capture and absorb that scattered photon as opposed to this one. The lower grid ratio will allow more scatter to go through than the higher grid ratio. So let's do an example, a test example of what kind of question you would get. And so looking at this, a grid is made up of, what is this? Lead at 150 what? Micrometers thick. Interspace material is 200 micrometers thick. The height of the lead is 2,000. What is the grid ratio? Okay, you have more information in there than you need, so what you have to remember what is needed. The height, right? 2,000, and then the thickness, the distance between them, which is the interspace material, regardless of what it's made of. So this question can be a little tricky if you're not sure of the wording. We don't care how thick the grid strip is, just the distance between them, which would be the interspace material. So what grid ratio is this?
10-to-1?
10 to 1. That's what it is, 10 to 1. And that's about a medium to low grid ratio. So that's how you do that kind of question. And you will have that on your test. So make sure you know how to do that. Okay, the other one, grid frequency. This is how you do that. For every centimeter, there's 10,000 grid strips, 10,000 grid strips at micrometers per centimeter. And then T plus D. What the heck? That's the thickness of the grid strip plus the distance between them. So here you do want the thickness of the grid strip. So going to this one, we have grid strip width of 25 micrometers and an interspace of 200 micrometers. What is the frequency? So you take 10,000 and divide it by those two combined numbers to find out. Here's 44 lines per centimeter. And again, as you go up in the number of lines per centimeter, the frequency increases.
Where'd you get that?
It's a given, it's a constant. Okay, so that number that won't change.
The 10,000?
Unless it's given to you that it's changed. That's pretty standard. And so you'll have a question like this on your test.
Will you ever give us a question where that number is changed?
But I could, and but I'd have to state it, and then it would be given to you. But I won't. I'll just keep it just like this. Except this number will probably be different, and this number will probably be different.
Oh, come on.
I know.
Too much.
I'm so mean.
It's too much.
Okay, now those were the two physical factors, and those, and I would have to tell you is grid ratio. When I go to select a grid, ratio is pretty much what I'm looking at for everything. Frequency, not so much, but there are other things that make a grid more efficient than just those two physical factors. And those are the functional factors, and these are the functional factors: selectivity, contrast improvement factor, and the Bucky factor. Again, of these three, this is the one that I am most concerned with. I think in your book there's formulas associated with these two. I'm not testing you on the formula. I'm not doing any of that. I don't care about that. Selectivity. When we talk about the selectivity of a grid, we're talking about the ability of a grid to let the primary beam go on through like we want, and the capturing of the scatter. So we want the beam, we want the grid to be very selective. Oh, primary beam, go on through. Scatter, no. Okay, they're very selective. So the higher the selectivity, then what does that tell you about the efficiency of the grid?
Better efficiency.
It's more efficient, absolutely. Contrast improvement factor. This is the ability of the grid to improve contrast. Now we know a grid is going to absorb the scatter, so therefore the image is going to look like we did with the collimation. It's going to look a little bit sharper, a little bit clearer. And so it increases the contrast, makes it look more black and white. So for contrast improvement factor, I don't know why, K is used. And so for the contrast improvement factor, it's always been like that. As the contrast improvement in factor increases, then the efficiency of the grid also improves. And then the last one is the Bucky factor. So these are direct relationships that pretty much make sense, right? Nothing hard about that. The Bucky factor is what we have to do when using that grid. What do we have to do to our technical factors to compensate for that absorption of the scatter? Okay, so increase in exposure to compensate for the density loss that the grid, again, when the grid absorbs the scatter, we have less density on our image. Well, we need enough density for our image that body part we're looking at. So we have to compensate for that loss. And so the Bucky factor tells us how much we need to increase. So if we increase the grid ratio, the higher the grid ratio, the more efficient it is at cleaning up scatter. Therefore, we have to increase more in our mass to compensate for that. So it's like a two-edged sword. Yes, sir.
For abdomens, we use grids, right?
Yes, sir.
But abdomens, we want a lower contrast in the look, right?
Yes.
So then what do we do to our technical factors in that?
You would select the correct KV for penetration, and then you would increase the mass.
Oh, okay.
Okay, so increase the grid ratio, then we're going to have to increase the exposure. So how much do you increase to compensate for the grid? And there are fairly definitive numbers for this. So if we're not using a grid, we give that a factor of 1. But if we're using a grid, and typically you won't use these lower ratio grids, typically we either have an 8-to-1 or 12-to-1 grid in our departments. Now let me tell you, when you're going out to, when you're going out of the department to do a portable, your grid ratios tend to be a little bit lower than what we have underneath our tables in our room. Let me tell you, the lower the grid ratio, the more margin of error you have in making that exposure. So let's say you're doing across the table, even if you're in the room, but your grid is outside of the table. Any angulation of the grid, any angulation off perpendicular of the tube can cause you problems. So when you're outside of the table, you have that chance. So typically your wafer grids, your grid caps are a lower ratio to give you a little bit more margin of error when you're dealing with the patient maybe in a bed. And then typically in your tabletops, it'll be more like a 12-to-1. Now 16-to-1 gives you what kind of cleanup?
The best.
The best cleanup. However, your margin of error, as you get better in the cleanup, your margin of error decreases. So you have to be spot on with your angulation.
So you're talking about positioning, right?
Of your X-ray tube to your grid. Not patient position so much, but your X-ray tube to your grid. And we'll talk about grid cutoff here in a second. Yes, ma'am.
Okay, so I get that it's attenuating the scatter radiation, which increases patient exposure, but because we have to increase the mass, which increases patient exposure, are we actually overall increasing the patient exposure?
Yes, that's an excellent question. You are, every time you use a grid, you are increasing the patient's exposure by, if you use an H1, by 4 times. Yeah, you're using 4 times the mass. So that's why we don't use a grid for a hand. That's why, we don't use grids unless we have to. Again, 10 centimeters or more. And why do we use a grid? Is to make our image look better, to see that visibility of detail, to increase the quality of the image. So we don't use it for small body parts. We only use it for our large body parts that produce more scatter, because we are increasing the patient exposure. We're doing fluorography with the interns right now, and we have a section on pediatric radiography. Let's do a pediatric abdomen. Let's do a pediatric chest. Let's do it on a 2-year-old. Grid or no grid? No grid. We don't use grids on our infants. Pediatric patients, that's quite a range, but again, on our babies and small children, we don't use grids because of this. And plus, they're not going to scatter that much anyway. They're small, right?
Yes, do you use them on pregnant women?
We typically try not to x-ray pregnant women, but if I have to do an abdomen, and I've done it before, if I have to do an abdomen exposure, we used to do for fetal position, a 1-shot abdomen for fetal position. And these women would be in labor. How fun is that? And so there were no readings. I mean, it's just now, I don't know why we did it then. We had ultrasound. I mean, ultrasound, heck, I think they could even feel the head as opposed to doing an x-ray. But yes, we would use a grid on a pregnant female. And like I said, if we messed up our technical factors because, we're using film, too bad. We could still see, enough to see the position of the fetus, whether the head was down or whether it was breached. Which reminds me, so I don't know why, we never do that now. we don't do that. We have ultrasound, and very quickly the sonographer can find where the head is, whether the head's to the side, up, or down. Very quick as you could with an X-ray. So I saw two doctors turn a breech baby to get the head down. Oh my gosh! I thought I would die, but so we found the head with the ultrasound. We found the rump. They oiled up the mom's abdomen and their hands and got the baby. We found the head, and they literally, one said, "You go this way, I'm going that way," and they maneuvered that baby with the head down so they didn't have to do a cesarean section.
Wow.
And the mom was great. I was probably the one that was having a hard time. The mom was great. I'm like, oh my gosh. Of course, poker face. You can't sit there and go. You have to act all cool, but inside I was dying. Anyway, but they did a good job. I'll just never forget that. That was so awesome to see that. Okay, I don't know how that happened. Anyway, so you do need to know. So if I ask you, like this question, this one's out of your book. Notice they don't have a 10 to 1. We have quite a few 10 to 1 grids. I don't know. This is a 10 to 1 grid, so they're not obscure, but typically the 8 to 1, the 10 to 1, you use the same Bucky factor. So this one's out of your book. I think that one's out of your book. And here I put it in there for you. Notice at the 8 to 1. So you will be using these, so do memorize it. Now, like I said, you're typically 8 to 10 to 1, and your 12 to 1 are the more common grid ratios. So 8 to 1 go 4, 8 to 1 and 10 to 1 go 4 times your mass. I can always remember this because 16 to 1 is 6 times. So you're not going to go more than that. You're going to go less than that. So 4, 5, and 6, just to give you an idea. You don't have to do that if you did not adjust your technical factors because of your grid. You use the same thing you always did. What might your image look like?
A little
So
noisy.
you didn't compensate, so you're going to have less density. So what's it going to look like?
A little noisy.
Absolutely. You're going to get the quantum model. You're going to get noise. Do you have to repeat when you get noise?
Yes.
Absolutely. So you need to go up in your technical factors. You can probably go up 4 times for all of them. That'll be close enough. But you don't want to not adjust for that. So here is an example, and again, you'll have one like this on your test. Without a grid requires 110 kV at 2 mass. If a 16 to 1 grid was used, what is your new technical factors? There are charts that show an increase in kV to compensate for a 16 to 1, but can you imagine you're already at 110? How much kV would it need to compensate? 20 to 25 kV. So I've never been a proponent about changing kV to compensate for that, because it'll take you way out of your range. Changing kV 20 kV will put you way out of your range, and this included. So we just change your mass, and I think that's easier to remember anyway. So 16 to 1 is, so what's your new mass?
12 mass.
12, so you're just going to use 12 mass. That simple. That's simple. Any questions about that? So some of the stationary grids, and Nick, you mentioned this earlier. This is the very first one, was the crosshatch grid. So you had grid lines going in both directions. And excellent, oh my gosh. Scatter going in any direction is going to be caught. Now you can imagine a grid line with the grids going in one direction. Scatter that is going along the grid lines will not be absorbed. So here, that scatter radiation going along the grid lines will now be absorbed. But you had better be precise in your centering. You have factors that you need to pay attention to when you use grids, so that you don't get grid cut off. And you cannot angle this whatsoever. It has to be straight, perpendicular, and right in the middle of the image. So we do not use that. You can see the frame here. Well, you probably can't tell. This was made out of wood, and this was all lead. And right.
Connect Four? The game
The
Connect
game
Four?
with the red.
Red.
Yeah, oh, yeah, yeah.
Go for it.
This is when I date myself, right? How about spider solitaire? I know that one. Okay, so again, I'm gonna get back four. I'm gonna have to play that now. Okay, Rise the game, right? Okay. Do I find it on the computer?
No.
No.
Some pieces might be missing for you. Okay, before the problem with your microphone is
Okay, as I said, with the grids now, they're not crosshatched. You can angle along the grid lines. You cannot angle across them. Here's a parallel grid. The earlier grids were not, I'm sorry, I misspoke. These are parallel grids where each grid line is parallel to the other one all the way out to the end. The problem with this is because the beam is divergent, that X-ray photons that are coming at this great of an angle will be absorbed by the lead strips. So your image will be okay through here, but on the peripheral of the image, if your body part went all the way out to the edge of the image receptor, then that could be have some primary absorption. So that's the problem with this. And you can see down here, this is exposed properly, and then you can see where the grid lines have absorbed the radiation down here, the primary beam. So we get that peripheral grid cut off. So then the grid was designed, and not all of them are still to this day, but then you can see that the outer edges now are what they call canted. They're angled to where it matches the beam. The ones in the middle are still straight, but the ones on the end are brought in a little bit. So then that way you don't get that peripheral grid cut off. However, it does have what they call a focal range, meaning your SID. So from your source to your image receptor, the SID has to be within that range. And usually they give you a little bit of a leeway. So like for this one, the focal distance is 36 to 40 inches. So if you're within that range, you won't get any grid cutoff. If you're outside of that range, you'll get some grid cutoff. So you have to pay attention to your focal distance, your SID. And then you get the appropriate density throughout your image receptor down here. And this is what I mean by your focal range. Usually it gives you a little, this is maybe a 40-inch SID, and that might be 42, and this might be 38 inches, 38 to 42 inches. As long as you're within there, it'll match the canting of the grid lines. So here's the moving grid. Hollis Potter invented the moving grid. He just took this off Bucky's grid and moved it to blur out the grid line. So you had to have some motion of that. And so some other names, which we never use. Poor Hollis, we don't hardly use his name. I've heard it called the Potter-Bucky diaphragm, but that's from somebody a long time ago that was old. So we don't call it that. In fact, we just say the grid or the Bucky tray or the grid. I don't really call this a Bucky, although it is, but we just call it a grid. So, and we, I'm laughing because if you went to the hospital and said, oh yeah, let's use the Holl's, the Potter-Bucky, diaphragm, they'd go, what are you talking about, you freak? What are you talking about? No, we never mentioned poor Hollis. But anyway, that was the purpose, is to blur those grid lines so that we wouldn't see them. So the very first one was a single stroke. They actually had to, and this was way before my time, would actually bring the grid, I don't know how they cocked the device, but they would bring the grid over and then during exposure release it, and then it would move in a single stroke. And so, but back in the old days when they were using this, the times were longer. 1/20th of a second was their longest time, so you could capture that kind of motion. I mean, now we're using 1/1000th of a second, so in order to capture motion, which in this case we want to capture the grid moving, then you have to have a very fast moving grid or longer exposure time. So it worked back then. So then they did the reciprocating grid where it moved back and forth. Okay, so it moved back and forth, not just one direction. then 1/60th of a second, as fast as 1/60th of a second could be used to capture that. And then what we have today, it says 1/20th of a second or less. Now we're using, like I said, 1/1000th, or 1 millisecond times. So much shorter. So again, it moves in all four directions. It oscillates, vibrates in all four directions, and it doesn't have to move as much as these two because the times are so short. So grid cutoff, this is, oh my gosh, this has given me such frustration in the past when I was first working with grids, and now I just look for, anytime I use a grid that's outside of the table, whether I'm going across the table, I'm using it in a portable, I take an extra 20 seconds